All right, let's talk about shadowing. This probably gives some people kind of confusions about what to do and how to approach it, but hopefully after watching this video, things will be a lot clearer. So why should you care about shadowing? Well, it's basically a requirement for BSMDs. Now, imagine you are applying to a BSMD program or even as a pre-med, right? And you're telling somebody you want to be a doctor, but you haven't actually seen what a doctor does. What do you think they're going to say? Next, it's going to confirm your interest in medicine and narrow down potential specialties, right? So by actually seeing different doctors and different specialties, you'll actually be like, I don't think primary care really is for me. I want something more of a specialty, like cardiology or nephrology. Or, I really like surgery. I want to focus more on that. This is where you actually get to see what types of medicine is, and you go from, I want to be a doctor, I want to help people, to, I want to be a neurologist. I actually want to work with people with Alzheimer's, or I want to work on neurodegenerative diseases. Like, you really start honing in your niche, and that makes it a lot more impressive. It's content for essays. You actually are with a doctor, you see them talking to patients, caring for patients, you learn a lot, and they're very interesting experiences that, again, it's fodder for your essays. Now, you basically can't apply to a BSMD if you don't have any shadowing. It weakens your narrative. You say you're somebody who wants to help people and become a doctor and this and that, but you haven't seen what a doctor does. You then don't know what you're talking about, right? So what is it? So some people may be not so sure about what a shadowing is. It's basically when you observe a physician in a clinical setting to understand their daily responsibilities, decision-making, and patient interactions. And like I mentioned before, the definition really is in the name. You're like somebody's shadow. You're just walking around and seeing what they're doing. You're usually not going to be actually involved in any kind of care because you're a student, but at least being like a fly on the wall and seeing what's happening is very valuable to you. So the different kinds of shadowing that you want to keep in mind. First is general clinical shadowing, right? This is where you basically shadow somebody who's like a primary care physician or a family medicine physician, like the doctor that you go to for your annual checkups. Those kinds of doctors, they are generalists. They see almost everybody. So that is like a general kind of shadowing. The other kind is specialty shadowing. So this is where you're going to now work with like a pediatric cardiologist, like somebody who's very specialized in their field of medicine. The other is surgical hospital-based shadowing. So the first two are more like in a clinic. So, they can have a clinic out in the community where you go see them. But if you're shadowing somebody who's a surgeon, they're going to be in a hospital or an ambulatory care center. So this is for somebody who wants to get a deeper understanding of procedures. For example, you can shadow an orthopedic surgeon doing ACL reconstruction surgery or doing a below-the-knee amputation or anything like that. Virtual shadowing, this is kind of a more recent thing, a modern thing, but for those who can't access in-person opportunities, you can participate in things called the Premed experience or virtual clinical education, whatever it is. Doesn't really matter, but they're basically like virtual types of shadowing. This is like the only time you choose this is if you exhausted all of your other opportunities. Shadowing is done in person. There's no live shadowing. These are like, compromises, and it's better than nothing. Absolutely better than nothing. If you're like, I've really, really tried and I couldn't get an in-person shadowing experience, you can then go for that. But that is like plan D. Don't even think about it until you really couldn't do anything else. But all right, how are you going to do this? First of all, you need to identify physicians to shadow. So I need to identify either the specialties or the actual doctors that you're going to shadow, and then reach out effectively. So when you identify the physicians, one thing you can do is try a couple things. You can always ask your own family doctor if they know other doctors know doctors that you can reach out to. You can see if you have any family connections to doctors. Maybe there's doctors in your family or they know somebody that you can ask. Usually makes things a lot easier. The other thing is you can also just like go on Google Maps and then search family doctors or primary care physicians in your area. And you get a bunch of little pins about all the clinics that fit that description. You can just cold call them and say, hey, I'm so-and-so, and I was just trying to see if you have an opportunity for me to shadow as a high school student. Love to hear more. Really mixed bag of like results with this, because you are just cold calling people, but you're usually talking to somebody who is the decision maker versus like applying to a hospital application and like there's a whole bunch of administrative things to really deal with. The next is be an active observer. So when you're shadowing, although you're not doing anything, at the very least you can do is be active and really, really be intentional about what you're seeing, and try to understand why something was asked or why a certain maneuver was done, and keep write all those things down. Don't interrupt an interaction that's happening, but then ask the doctor later, hey, thank you for the opportunity. I really noticed that with Miss Jones, you decided to not ask her about, her drinking problem, for example, or whatever it is. I was wondering why you thought about doing that. Really try to understand this. And then the one thing that I see everybody forget is to document and reflect on your experience. The day of that experience, the day of the shadowing. You're going to forget a lot of the details, but there are some really, really neat experiences that you can have in shadowing that I want you to remember a couple years later when you're writing your application, as if you did it that morning. Okay? And the only way you're going to do that is if you actually document everything that happened, at least the things that stood out to you, both good and bad. Okay? Now, what you can do now is, first of all, identify 3 to 5 doctors in your specialty of interest, if you want to do a specialty, or you can just do something more broad, like a family physician or primary care doctor, and then draft and send the cold emails to those doctors. Identify some shadowing opportunities at hospitals. Some of your local hospitals might actually have structured programs to shadow. Check those out. Now, schedule shadowing opportunities and prepare thoughtful questions. So once you get on the phone or the email and you ask them and they say yes, they're like, yeah, let's talk. Let's see if this is going to work out. Come prepared with questions about, okay, so really interested, how many patients do you see? What kind of pathologies do you see? What kind of diseases do you see? The fact that you're coming in with questions shows that you put in some effort into actually being with that person. And, doctors are very busy. So if they give you your time, make sure you're not wasting it. Start shadowing journal, like I said, to document all these applications and these experiences, and explore virtual shadowing programs if there are no other opportunities. But I would urge you to still look at them, do this research, and keep a document, a running document, be it Excel or anything else, of those potential programs, so that later on, maybe a couple months down the line, if you don't find any opportunities, you can just refer back to it. Okay? Let's talk in the next video.